Hey everyone, myself Dr. Amit Patle. I am junior resident in the Department of Radiodiagnosis at Aiims Hyderabad. Today, I am going to present a learning case on urachal fistula. So history was a 6-week-old children brought by parents with complaints of pus discharge from the umbilicus since birth. Then this patient is referred from the pediatrics to our department and we did USG. So on ultrasonography we can see that. So here we can see that on transverse grayscale image at umbilicus there is a well defined ovoid anechoic cystic lesion, whereas at bladder and the same transverse image we can see that there is heterogeneously hypoechoic structure which is seen in the anterosuperior aspect of the urinary bladder. So here we can see that these two openings, and if we will see here in the sagittal section, so here we can see that a tubular structure originating from the umbilicus here and it is extending towards the bladder here. So we can see that a fistula tract terminates at the bladder, forming an abnormal communication between the urachus and the bladder. However, there is no evidence of any cyst or any cystic structure in the course of the tract. So these findings are suggestive of urachal fistula. Now let's discuss about the embryology and anatomy. So the urachus, or we can say the median umbilical ligament, represents the embryogenic remnants of two embryonic structures. The first one is cloaca and the second one is allantois. Now let's talk about the first, that is the cloaca. The cloaca is an endoderm-line structure which is divided by urorectal septum between the 4th and the 7th weeks of gestation, creating the urogenital sinus ventrally and rectum dorsally. Okay, so here we can see that the urogenital sinus ventrally and rectum is dorsally. The inferior portion of the urogenital sinus become the pelvic and penile urethra in males and the pelvic urethra and vagina vestibule in the females. The superior portion of the ventral urogenital sinus later become the bladder and its apex, which subsequently becomes the bladder dome, which is contiguous with the allantois. Now, around the 4th to 5th gestational month, involution of the allantois and urogenital sinus occurs as the bladder descends into the pelvis, forming the urachus, which elongates, becomes a fibromuscular cord-like structure connecting the apex of the bladder to the umbilicus. Urachal remnants are present in almost 100% of infants at birth and regress due to fibrosis with age. Eventually become the median umbilical ligament. Okay, this eventually becomes the median umbilical ligament. Now the urachus extends from the anterosuperior surface of the bladder to umbilicus and lies in the extraperitoneal space of radius, or we can also say that retropubic space, between the transverse fascia and parietal peritoneum. So look over here. Here we have the sagittal section of the pelvis, and here we can see that there is a urachus as a cord-like structure extending between the bladder. Here we have the dome of the bladder and the umbilicus. So this is the cord-like structure and it is in the radius space. Okay. Now it is accompanied on both sides by median umbilical ligaments, which are obliterated remnant of the umbilical arteries. So this is about the embryogenic development and anatomy of the urachus. Now, on the basis of the location of the abnormal residual patency along the urachal tract, there are 4 types of urachal anomalies. Now look over here. Here we have the 4 types. So first one is urachal fistula, and we can see that it is the abnormal communication between the urachus and the adjacent structure, commonly the bladder. It can be leads to complications such as persistent drainage and increased risk of infection. The next one is the urachal cyst. So it's an encapsulated fluid-filled structure along the course of the urachus, often asymptomatic but prone to infection if cystic content becomes stagnant. Then we have the urachal sinus. So it is a congenital anomaly where persistent communication between the umbilicus and bladder exists, forming a sinus tract. It may present with intermittent drainage of the infection. And the last one is urachal diverticulum. So it is a pouch-like structure outpouching of the urachus, creating a blind indent structure. It may be predisposed to the urinary stasis and recurrent infections. So these are the 4 types. So that's okay. Thanks for watching this video. Happy Makar Sankranti and stay tuned for the next one.